When I first came, I had gingivitis. Like I said, I hadn't been to the dentist in probably 10 to 20 years. And my teeth were loose and a lot of bone damage and stuff, lots of plaque. I take a lot of medications, so my teeth get really more plaque than a normal person does. And he did a deep cleaning on me twice, and that really helped, and it tightened up my teeth. It's really kept me with a good hygiene as far as my mouth goes. He really make sure that I stay on a 3-month cleaning, which is very important. My old dentist didn't have me do that. And because of that, my teeth have really, really improved. And I really enjoy coming here because, it's painless and everybody's nice. So the first thing everybody asks is, what do they give you? Is it painful? Does it hurt? And I explained that, you can have the nitrous. And I didn't use the nitrous for the first, probably year I was here. But then as I got older, my teeth, I decided just to try it and see if it worked. It didn't hurt after that, and she uses a great topical. In fact, I have a new one that is so good that I didn't feel a thing this last time. From Dr. Miller to every member of the staff, they are so wonderful. They really treat you very well. There's never any pain, which is always a good thing. He really does a great job, and he explains everything to you thoroughly. The job that they do is just wonderful, and Dr. Miller is just a sweetheart, and I really like going to him.